Hello and welcome to another episode of Easy IVF. I hope you guys have been having fun with some of the videos that I've been uploading recently. If you do have any questions regarding the videos I've been uploading, please feel free to just leave a comment below and I'll make sure that I get back to you guys as soon as I can. Today we'll be talking about a very important topic. What happens when you go to a hospital or to a clinic and you were told you don't have any sperm count or you don't have sperm at all? Does that mean that you are not able to have a child at all? Where does that leave you? So at times, a semen analysis report can sometimes reveal jaw-dropping information that might make you be in a state of shock as to like, how did this happen? You're told you have no sperm and you're not able to have a child, or your ejaculate contains no sperm cells. It can be very, very surprising to most men as to how they have an ejaculate but there is no sperm in the ejaculate. One thing you should understand is that when you ejaculate, the ejaculate itself contains sperm cells inside. So the ejaculate that you see, it's not actually the sperm cells. The sperm cells are minute cells that you cannot see with your naked eyes that are located in that ejaculate. So the main focus of this video is to help you understand what options you have when you've been diagnosed of azoospermia or teratospermia. Azoospermia means that you do not have sperm in your ejaculate, whereas teratospermia means that you have sperm in your ejaculate, but those sperm are morphologically abnormal. So sperm production normally occurs in the testicles. Men produce millions of sperm cells every day. In your testicles, there are tiny tubules where all these processes take place. So during sexual intercourse or during masturbation, if you ejaculate and your ejaculate contains no sperm, or say for example your ejaculate contains sperm that are morphologically abnormal, or let's say you have some genetic issues where you don't have ejaculate at all, then there could be surgical interventions that could be done to help you retrieve some sperm, and potentially those retrieved sperm cells can be used in an IVF ICSI cycle to fertilize an egg and possibly achieve a healthy pregnancy through that. Here are some of the ways sperm could be retrieved when you have no sperm in your ejaculate, and this is a surgical intervention that requires a local anesthesia. So the first one we are going to review today is testicular sperm aspiration. To make this short, it's also called TSA. So testicular sperm aspiration. So this is a procedure that is performed for men who are having sperm retrieved for IVF or ICSI. So it's normally done with local anesthesia in the operating room, and this procedure is normally done prior to the retrieval of the egg from the partner. A needle is passed into the testicles and they try to aspirate some sperm from the tissues, and this is normally done for men who had vasectomy where there is no connection between the ducts, right? Because the duct has been cut off. So normally they will just go in there and do a biopsy, and hopefully they can find live mortal sperm to use for injection. If no sperm is found, then there is a likelihood that they will open up the testicles to get more tissues for culture and potentially find something in there to use. So for open testis biopsy as well, basically they'll just make an incision in the lining of your scrotum, and then they'll open that up and try to biopsy some of the scrotal tissues to dissect out and look for sperm cells in there. The next one we're going to talk about is PISA. So the meaning of PISA is percutaneous epididymal sperm aspiration. So for PISA, So PISA does not require any surgical incision. You do, however, still require anesthesia. A small needle is passed directly into the head of the epididymis, and through the scrotal skin, and some of the fluid is aspirated. So once that is done, the embryologist will now retrieve the sperm cells from the fluid and prepare them for ICSI. So the difference between PISA and TISA is that in TISA, a testicular aspiration and biopsy, and that might require opening up the testis for a biopsy, whereas in PISA, it's just the needle is going straight to the head of the epididymis to aspirate some of those cells and fluid there for possible sperm culture. The next option is TISA. TISA is testicular sperm extraction. With testicular sperm extraction, an incision is actually made into the testis, and then the physician or the doctor would kind of like examine the tubules for the presence of sperm. With TISA, because of the volume of the tissues extracted, most of the patient freeze some of those sperm cells or some of those tissue cells for possible reuse in the future. So basically, when they get some of those samples, say for example 10% might be used for that treatment that day, and the rest of the aspirated samples would be prepared and frozen so that you don't have to go through that again. And so all you have to do is, when you're ready for another cycle of IVF, if the previous one failed, you come into the clinic and they thaw the previously frozen sperm and then reuse that for your cycle. And let's say for example, if you're able to freeze 4 to 5 straws, that might give you 4 to 5 cycle, and that's more than enough for you to be able to have a child. So the last surgical intervention for people that have absolute no sperm cells due to vasectomy or congenital bilateral obstruction of the epididymis is MISA. This is microepididymal sperm aspiration. With microepididymal sperm aspiration, what happens is that an incision will be made into one of the single tubules that you have, and once that incision is made, the fluid that spills from that tube is collected and prepped. And with MISA, most of the sperm that is collected is already mature compared to the other procedures. The only downside with MISA is that most times the sample could be contaminated with some of the red blood cells, and that might affect the fertilizing capacity of the eggs. However, an experienced embryologist or andrologist is able to like spin down and separate the cells, and all you need to get is one sperm at a time to inject into an egg. So there you have it. If you've been told that you have no sperm and possibly using sperm donor is your last resort, you can always mention these techniques to the doctor or to your physician or to your primary physician and just ask for a referral to a urologist who is able to perform some of these procedures. Also make sure that once you go in for this procedure that you freeze the sperm that you get at that time, right? So if you're able to freeze the sperm you get following any of these procedures that I've mentioned already, then you don't have to expose yourself to local anesthesia and to surgery and all that stuff. And moreover, you still have to pay every time you come in for any of those interventions anyways. It's way cheaper to have that surgical intervention done, have your sperm frozen, and then come in for an IVF cycle, knowing that you have some sperm in the bank. Before you make up your mind to use a donor sperm for your IVF or ICSI cycle, make sure you've spoken to your doctor about your options regarding MISA, TISA, PC, and MISA, right? So just make sure you've spoken to your doctors regarding those options. If you have syndromes such as Klinefelter syndrome as well, you can also benefit from some of these surgical interventions. And all the embryologist needs to find is one motile sperm to inject into an egg. Depending on the number of eggs that are retrieved, these procedures are really, really life-saving, and they can help you start your family in a short period of time. I hope you've loved this video, and thank you for your patience. Cherish life.